I'm going to just share a little bit. We're in a no-cost extension of a NIDR, National Institute on Disability, Independent Living and Rehabilitation Research grant, what they know as the DRIPS. And this is a no-cost extension. And I want to share a little bit of really about our learnings. And I really would like to have a conversation, and it leads very nicely after the conversation. If you were here right before lunch conversation, it sort of builds upon a lot of the issues that people were bringing up. And so I'll share just a little bit of data and a little bit of the model, but I really want to get into what we continue to define at the local level and the implications for that. So it's the Indiana School to Work model, and there's reasons why we called it that. But so today is pretty much what I've said. There's a couple things I'd like you all to remember, that when we started this was pre-WIOA, so that had not started yet. It happened in the middle of this. And so we will have lots of conversations about intended and unintended consequences of policy changes and procedural changes. So I will be bringing that up quite a bit. And that's what I'd like to talk about. And also some of the local solutions and challenges that came forward. I have to give credit to NIDR, and this is the title of what our research project was, or our project was. But as you can imagine, working with high school students, you don't want to say, hey, do you want to be part of the effects of embedding employment resource center project? So hence the Indiana School to Work Collaborative. So before I really get into a little bit of the ins and outs of it, I want to tell you a little bit of how it started. And we like to think about this approach as a collective impact approach. There was an urgency for change. So right before we started, Indiana's always had a really nice relationship with VRs and school and providers and collaboration, and things just sort of fell apart. Not surprised, some chairs changed at the state level, some initiatives were falling apart, and things just weren't happening. Schools were talking about some issues. One was there was a group of kids who they were struggling with holding on to. They were either going to drop out, they didn't know what else to do with them, and they were really needing some help with that. They also had some complaints about some of the providers, and I can go on and on with some of those complaints. The providers were saying that their relationship with schools were falling apart, and from both sides of it, if a school found someone a job, it was so part-time that fell apart by the middle of summer when the student left. You guys are nodding, and you guys, oh, I can relate to this. The providers, so they were complaining about that. Our schools said providers weren't doing a really good job with providing the ongoing support. There were some issues with VR getting into the schools early enough, and/or kids were already gone, and we lost a lot of students leaving high school and not connected to VR or the other adult agencies. So throughout this, we brought everybody together, and what we're calling the authentic student or stakeholder engagement. This model, I would love to take credit for it all, but it really was these people who did it. They designed it. I wrote the grant, but they designed it. This is what they wanted to do and what they thought would work. We have a statewide transition policy group that oversees a lot of things, but they were overseeing this project to give us input, but really to talk about policy issues or procedural issues that needed to change. And from the very beginning, we talked about whatever we designed, we needed to think about sustainability. So the ultimate goal when we started talking and bringing people together to make that design was, how will we sustain this? So Voc Rehab was at the table at the very onset of it. I'm really, really fortunate in Indiana. We have a fabulous BRS director. I've known her for years, and she was really, really involved with saying, show me the data. She was at the table when we were having our ongoing bi-monthly meetings with all the locals. So this is the framework. You could almost think of this as we used it as our logic model, because what we knew we needed to do was look at these areas: policies, what are the guidelines, what are the barriers or the impact of everyone working together, what were the procedures that were hindering kids getting out and connected to VR and or providers to find the job, what were the locals using evidence-based practices. We know good transition practices, we know good employment practices. We've got a lot of research. Are they being used at that local level? And do we have the right people at the table? And are those stakeholders coming together to make things happen? So, I really want to get to that outcomes of what we learned, but this was what we're calling the intervention package. We had 5 control sites, 5 intervention sites, and here was what was unique. We had the providers come together to work as a collaborative. One of the issues that surfaced, and I'll mention it again, was that schools were complaining, especially in our larger cities like Indianapolis or the southern part of our state, Evansville, who have a lot of high schools, that too many of the providers were coming into the schools wanting teachers' time. And so one, teachers can't do that. They're in a classroom, or the department chair had meetings or IEP meetings and they were asking for too much time. The other piece of it was to ensure some quality. So the providers came together to work as collaborative, and as part of that, they actually wrote an MOU together, which really surprised me. And I was saying, is this really what you want? So any provider coming to the table who is going to work on behalf of working with these schools had to sign the MOU. And it was really about the quality of the staff they were going to bring in, some of the rules they were going to talk about with each other. So that was something they brought up. Now, for all the VR folks, you all know that you have to give informed choice. But part of what this agreement was is that if you were going to come and work with these schools, you have to agree with this. And I will tell you, we had providers who said they didn't want to. They didn't want to be part of the collaborative because they wanted to ensure that all the people going in there were well-trained in employment specialist training, that they understood how to work with schools and identify the culture of that school. And so that collaborative providers work. And so if you think of Indianapolis, for those of you who may know, it's a little bigger city. There's like, including our mental health centers, around 26 employment service providers. So can you imagine if even half of them were working on one side of the city? You know, you could have 10 of them working in one school district. So they really wanted to make sure that they were being respectful with schools. So at that local collaborative piece of it, that's how the providers worked. One of those providers was the fiscal agent, and they hired what was a career coach. So the career coach was the single point of contact representing all the providers around the table, and they were embedded in the school. And I'll talk a little bit more about them. The discovery process profile, you all are aware of it. We started this at the beginning, and I'm happy to say that our VR took it over to have a requirement across the state. We knew that paid work is a predictor of post-school outcomes, so everyone had to participate in the work-based learning and or some internships. We had the schools working in conducting self-determination training. We knew of 3 evidence-based curriculums. We used it as a framework for the teachers to use, and they did it at varying times. So I know some of you could be thinking about what's happening with your pre-eds. So the culminating activity for some of the schools was that kids would lead their own IEP meetings, or that kids would be more active. Some other things emerged from it, but the schools took lead on that, and the career coach helped with it. Benefits counseling. We have a benefits information network in Indiana where VR pays for a benefits counselor, a benefits plan prior to going to CWIC. So even before going on to the work, a benefits plan is conducted for an individual. And then we did a lot of family training, and our parent center had a representative at each of the local collaboratives. So a local collaborative would be made up of our VR staff, our providers, our schools, parent representative, and any other agency that was involved in the employment process. It could be independent living, it could be DD. Following me? Everyone's all right? So just the two unique aspects of the collaborative. The one was the career coach. And the career coach, and one of the reasons this was designed as this approach, was embedded in the school because our past experiences were that providers were going into school and not understanding the culture of schools. You can't take a kid out of a class to go do job exploration when they need the English credit. You know, there's a lot of a culture, and each school has a different culture. And so really that was a big piece of it. The other piece of it was to get to know the teachers, to get to know the kids, to get access to the kids, and to have more of that overlap of services. I always like to talk about my Barbie dream world so that I could see where the school has started doing some nice things. The provider in VR, meaning the adult providers take over, the schools are backing off, and the providers are taking over. The reality of it is that most families are not going to trust anybody but schools because that's who they've been with for the last 12 or 15 years. So to all of a sudden, all these other agencies come in, families want to know, who are you and why are you at this meeting of my child? So that was really that purpose, that career coach can navigate the systems for the families and the students. The coalition, again, of providers was to reduce the number of people going into the schools, to reduce the confusion for schools to say, who are you? Weren't you guys just here last week? No, that was a different agency. And also to look at reducing the duplication of services, which we knew there was some duplication between sometimes schools and adult providers. Everyone's going out looking for work experiences. So how many people are going to hit the target at the same time? And again, for employers, they were saying this is getting confusing as well. So there were the two primary groups of kids that we were going after to think about. We had a large group of kids that schools were struggling with that were going down this diploma route and then for whatever reason was coming off. And so schools were struggling with keeping them engaged, keeping them in the schools. There was a lot of other issues happening around them that they needed some help with. And they also knew that because they weren't fulfilling some of their credit obligations, they weren't getting access to like the career tech programs and some other programs. There was also another group of kids who were getting their diploma, had no intention of going on to higher ed, but because they were spending all their time in the credit courses, weren't getting good work experiences to really explore those career options. So we had to make sure that we were also, and had an uncertain future. Even if they went on to higher ed, they had no idea where they were going. So that was another group of kids. Does that make sense? So there was a couple research questions I'm going to go through quick because I really want to have the conversation with you all, some of the implications and some of the learnings. Well, we wanted to know if we embedded that career coach, the employment resources in the schools, would kids more likely leave with a job and would that job have higher wages and those outcomes? We were all really interested in because we were very concerned prior to this where there was a lot of students who wasn't who left school without any connections to VR and obviously the employment providers. In Indiana, the employment providers do the majority of all the job development and the supported employment and other employment services. We have the business liaison, but it's these providers who do the most of it. So we had a lot of concern that we found out there was a lot of students leaving school and they still weren't connected to VR. And then we wanted to see, were there any need for a policy or procedure change? We guessed it, we weren't real sure, and until we got in there, what would happen? So I'm just going to share a little bit of data because I could be here for a while with all of it, but I just wanted to highlight some things that we talk about the implications of policy and procedure changes. I know this is hard to see, but this is just the primary disability was compared to our control sites. Both of them were the same: autism, people with emotional disabilities, um, and then learning disabilities, mild intellectual disabilities, and then a percentage, a higher little percentage of folks, other health impairment, that it could be the gamut of individuals. So those were our primary group of students, and those were the students that schools were feeling like they were losing because of some of the diploma requirements. So we had a number of internships and experiences. The length of internships was around four weeks, 1 day to 27 weeks. Through this, although the grant paid for it, VR also paid for internships with students last year, and that was part of our sustainability plan as well. The average student participated, their hours were 9 hours in internships. Leaving school, the average, we are still at a minimum wage, the federal minimum wage in Indiana, but was $9.23. 91 students left school based on the internship or work experience they had during that time. And then 91s, after 3 months later, 85% were still working, and 3 of them had a career advancement. So we were pretty excited about that. And I didn't want to get into the research, a lot of it. Well, what our 5 control sites, we really struggled with them because we told them, we did a self-determination assessment every year, a pre and a post, and we collected data. And what we learned from them was, as business as usual, nobody was following up on the kids. We couldn't even find out if kids were referred to VR. Someone would say, yeah, we referred, but we don't know what happened. The other piece about our 5 sites that were the treatment sites or intervention sites, 2 were more urban, 2 were very rural, and then one was sort of a small town, but it had a little bit more resources. I think would be classified as more that suburban kind of area. All right, I want you all to look at here, because this is what's going to talk about. We did a lot of ahas, and just the 2 lines, these are hard. Look at the vocational rehabilitation engagement. Our first year, 90% of the students were already connected with VR. The second year was 88%. Then the third year, it was 76%. And the fourth year, our last year of full implementation, only 53% were engaged with VR. And of course, providers have that same trend downward, but because you can't go to a provider unless you go through the VR door anyway. So that third year, a lot was happening, and we were hitting the local levels a lot to try to figure out what was going on. So I want you all to keep that data in mind when we keep going here. So now I want to just shift for a little bit. So that's what we started learning. So we asked families throughout all of this, tell us, we did some focus groups with the family representatives and also families that were involved, their children were involved in the project. They told us that the schools were the predominant way that they learned about transition services, and that's not a surprise, and it better been that way, or we would have been really worried if they weren't even learning about it. But it was the career coach who was the predominant way they learned about vocational rehabilitation services. But I think most of all, the career coaches were helping the families and the students maneuver through the VR process, getting all the collateral information. So it helped move the process along the way a little quicker. And I think there was a sense of security of, now we got another new person coming in. This was nice because I had someone to ask those questions. So they were the central person for communication and keep things moving along. So we found that parents tended to call the career coach to say, what's up, what's going on? They really appreciated one of the procedure changes that we had with VR was we were opening the cases at the beginning of their junior year. And there was lots of reasons for that, with one being the main intention was that for those students who were still going to spend most of their day in credit-bearing courses, that they needed the credits, we could start internships and work experiences the summer before the students last year. And then if we could do anything after school, we did that. But that was really helpful because, as you all know, sometimes it could take 3, 4, 5 months to get really things moving. So we realized that when we started that at that first semester, by summer, things were all in place. The provider was picked. Everybody knew what to do. Families continue to, and we're really struggling with this, they continue to struggle with how to understand all these people and all the processes. You know, how does the IEP, Individualized Education Program, the VRIPE, and if you've got any other goals or plans, how do they all work together? And why do I have to keep doing all these plans? That was still really confusing for them. And we've tried to simplify this in so many ways. In fact, one local district did a whole little chart for them. Everyone did pictures for them, but we know that we have to keep educating on that aspect of it. And I'll talk about this later, but families really expressed a lot of frustrations of a couple areas, the starts and stops of programs, or services, I should say. And the biggest frustration that came out was not only because of staff turnover, but the new staff didn't have all the documentation. So whether it be a VR counselor, whether it was the career coach, whether it was a job coach, families were so frustrated with the fact that the documentation wasn't there, and so the questions were asked again. And so that was something that really emerged that we've had conversations with is, how do we figure out this documentation at all levels? So if I'm the job coach and I'm out looking for a work experience for you or work-based learning, and I haven't documented where I've been and what's happened, I leave, the next person comes in, and guess what? We're starting again. So that was a real practice piece that we will continue to focus on. So so you get a feel for where we were, things were happening, people were connected. And it really worked from the level of that intervention piece of it. We have a lot of data on the self-determination. I'll talk a little bit about some of the other culminating activities, but we really started seeing things happening. But remember that data about connecting to VR kept going down. So we started trying to figure out what was going on with the policy or procedure changes that was causing this data to go down. So a couple things happened. On self-determination, because we know it's an evidence-based practice, it was really starting to work. Our Department of Education funded statewide training on it. That was a really good thing. I was excited about it, except it was going to really mess up my control sites data. And as much as I would like to say to them, it was unethical for me to do that. So I was really happy for DOE to say, hey, here's some money, I want you to do this statewide, and we did that. Our data from our control sites on our self-determination were not that different. We did these work dilemmas with them, but there was a little bit of difference with our treatment sites, our intervention sites, and part of that is because they also got technical assistance from us, from my team. We were in there helping to support along the way. So year one, we're beginning to implement, right? I think 90% were connected to VR. Things were going well, but in that year one, we moved to a new employment model. That really didn't change much for us because our new employment model was more of a hybrid between hourly and outcome-based, and it was very much, on paper at least, it's very much more consumer-oriented. And our VR is telling our providers, keep the cases open longer through that discovery process. Get to know the individual. Get to know them well. So that we didn't see much of the changes. Providers were okay. Financially, it was working. But then WIOA came in, PREETs came in, and order selection came in. The pre-employment transition model, our VR, like the collaborative approach, that the local collaborative work where providers came together on behalf of a district and one representative, the collaborative, that was that career coach, that's the model we use for pre-employment transition services. And so that we're not all bombarding schools at the same time. And that seems to be working. So I could be an agency of a fiscal agent, I could have all the other providers working, but we really have organized this in a way that one person takes lead in that district. It doesn't mean that I don't choose other providers as a student to provide my employment services. So just like the local collaborative, the school to work collaborative, that career coach just coordinated the other agencies, and we could have 3 or 4 in there providing services to students because they made an informed choice about who they wanted to provide those services. But one person was that lead. So teachers had someone to go to, department chairs, directors, everybody had that one person they knew were representing. And then VR changed the procedure of enrollment to earlier, and that was really powerful. That was really helpful for us. We were able to get a lot more students through. So again, I want to just remind, the first year was the new employment model, then WIOA, third year pre-ETS, and the fourth year order of selection. And this is what we learned that happened at the local level. In fact, some of our local levels became paralyzed. And when I say paralyzed, we know everyone was so confused, and schools were confused about the pre-employment transition services because they did quite, for some of them, they were saying, we already do some of this. And so part of that was a training piece with providers to say, you always supplement, you don't supplant. You supplement what schools are doing, don't supplant it. And so that took some time to work through. From our sites, couple of them were fine, they were able to move along, but a couple of them were just didn't know what to do and became really paralyzed. So here's some things that we learned, spending a lot of time at the local level, trying to understand it and what that impact would be. Here, staff turnover. The earlier conversation that we were talking about that many of you are struggling with, well, I will tell you in the beginning, we thought it was all about VR. And in fact, we started tracking from a referral to an actual authorization to a provider. And in one location specifically that struggled a whole lot with keeping staff, it took almost a year to get them to an application process because the turnover was so great. Supervisors were coming in, taking the applications. They were wonderful. But we thought it was just VR until we really started going into the data. And we said, everyone quit pointing the fingers at VR, quit pointing your fingers, because here it is. We all were, everybody was turning over left a fair amount. We couldn't even keep track of the job coaches. So after at a local school, if I chose a different agency to provide my employment services, we didn't even keep track of the number of job coaches that turned over. So this is where families were really talking about the starts and stops in services. And for a student, if you're going to tell them they're going into a school to work program, they're still in that school mindset. They expect us to be in a program a couple times a week. So when weeks were going on and they weren't seeing anybody, they just stopped. I mean, we lost some kids. We lost, from just, they dropped out of school. Couple went to corrections. But, that was the reality of it. So this is something we didn't plan for. And we all have been talking about it at our state level of it, but what happens at the local level for the student or the client is a huge impact. And the families complain of it. But here's what we learned about the collaboratives. When the providers came together, working together with VR, with the schools, the parent center, everyone really knew that area really well. So if someone left, other people stepped in. So if a VR counselor left while we were waiting for the other counselor or a career coach, the school would step in. If we lost a teacher, which I still made a teacher in the middle of the year, got a classroom and they leave, the career coach stepped in and did some things. So many of them just start doing company tours. They would call the VR business liaison and say, help us. If not, they went on their own with some. Transportation. Part of the culminating activity of the self-determination training was informed choice of the provider. So a couple of them did a speed dating with providers. So they would have the providers come in and they worked on this. The teacher, career coaches were working with them, and the VR counselor came in many times. We're working about how do you choose an employment provider? So they taught those self-determination skills and advocacy skills, taught them how to ask the question of the providers, and then they were able to make that choice. Parents were always invited, but not always came. And there were a lot of huge lessons. I mean, these are high school kids. So we also realized that one of the providers always sent a young employment specialist. High school kid, young girl. Who do you think they were always choosing? So that was something that came out of it. And the kids had to process, you've got to look at your data. And so that was fun. They did the mock interviews and then assisting in job fairs. Then in one of our larger districts, they reached out to their career tech program, the cosmetology, called some employer HR places and asked Goodwill if they can come over and get some clothes. And they did a whole fashion show of what to wear and not what to wear on interviews. And kids had to critique it. And what was nice about it wasn't just kids in the school to work program. It was also gen ed kids. So it was a larger group that did these fashion shows, and they did them together. And it was really informative. Some things we learned about the work experiences. For a lot of the kids who had some really good and different experiences, some of them decided to go on to post-secondary ed, which was a huge success for us. That, at that point that they entered, they just wanted to go into the workforce. So that was really helpful. There was a lot of exploration that they would not have had otherwise. But on the flip of that, we also learned that we saw a lot of lack of diversity of work experiences based on what the job coaches were finding. And so we had a lot of questions about how do we start expanding that? What do we need to do? That not all kids are going to go and do this almost like a rotation, but they all seem to be the same type. And then how do we push the edge there and really start working with different employers? So that was something we continue to struggle with, because we start seeing too many people in retail, and it's like not everyone could be interested in retail. We also did a lot of work around the reflection of what that local market looked like. So that was something that we start working with them on, saying, who's already in your community? How can you expand? The other thing that took a little while was that, as you all know, to do a true discovery process, you got to go lots of different ways to think about it. And we had we had several kids who basically came from a background that money was extremely important. They needed the money to help support their families. So it wasn't about, I want to go get this great experience. It's like, I need a job now. We did have a very diverse group of school districts. There were sometimes the career coaches were literally helping the social worker go to the cars looking for them to see if we could find the student. So what was really nice though, again, bringing that policy into the local level implementation, or the procedure into the local level implementation. I'm not sure if this would have happened if we weren't involved as that backbone organization to providing the TA, but we had a couple incidents where kids were in a part-time job because they needed the money, and the VR counselor wanted to close their case and saying, well, they're working. And of course I'm going, no, that's discovery. And fortunately, because I work so closely with our bureau director, I could pick up the phone and saying, we got an issue, we got to get out to counselors. And it was a great training for the VR counselors, but it was also something for us to learn to say, we don't want kids leaving jobs and letting the outcome for VR be a part-time job at a McDonald's or whatever it may be, that is part of our discovery process. And what can we learn about this student from there? Questions, comments?
Directly through VR.
So let's see if I get this to make sure I'm clear with you on this. So there was the local collaborative. And so let's say in one district, it's a small district, and there may be like 4 providers that are part of that collaborative. One of them was a fiscal agent and served as the career coach, was embedded in that school. And they were that liaison, making sure things happen. But the students got to pick the provider who they wanted to provide those work-based learning experiences and or lead to the job. And so those were job coaches would do that work, and they were employed by the employment provider.
Right.
So VR contracted with the employment, has a purchase of service agreement with the provider, employment provider, and those job coaches work for those providers.
Right.
No, that's how it worked. We don't have a direct job coach to go in. It's through an employment provider.
Okay. Yeah.
Can that happen? Yes. Does it happen? Not a lot. But the provider, in our true sense, we wanted a match between a student and a job coach, and the provider did do it at the best that they could. They would try to match personalities, or if a guy's if it's a big guy, maybe another guy just in case, depending on the disability, especially if they have an emotional disability and you need someone who you don't know what's going to happen. They'll try to make that match. And they also, it's not that they don't ever change job coaches either. If things aren't working, they'll bring in a new job coach to see if that would help as well. Does that help? Okay. So, right. So because we had some money in this grant, but remember from the beginning, we looked at sustainability. So the career coach was employed by one of the providers. They were the fiscal agent. But even though they worked for, and I'm saying this, Easter Seals Crossroads as a provider, they represented in the school all the providers that were part of the collaborative. And they had to buy into the collaborative, providers did, and agree that this is how it's going to work. And then, so now from a sustainability standpoint, pre-eds, and they were, most of them were in that school or school district fairly full-time, but remember, they weren't there 40 hours. So they were still bringing in some billable time for VR to help with the sustainability. And does that work? So fiscally, it worked. I mean, with the providers, that was something in the beginning we worked through. And then every year we were reducing the dollars so that they would have to look at sustainability. From the onset, VR had agreed, because they had agreed. We have 10 project search sites in the state, and they were paying for work internships there, so that we used the same model. And in the beginning, it was up to 3 internships in a year for a student. And so they still pay for work experiences still now. So that was all part of the sustainability plan. When we went to the new employment model, all the providers looked and said, we could sustain this in this way. Wait, I gotta go around the state and think. In some places, providers had really good relationships with the businesses. Personally, I think it's easier to sell a school program to an employer, because then they could tout that, hey, I'm working with my local school district and look what we're doing for kids, especially in kids with disabilities. But I would say in general, most of them were, the relationship with the providers were there. In the rural areas, we had a little more challenges. just because of the diversity of those work experiences. And as you're saying that, I was trying to think, Kathleen, I think like everywhere else, I mean, we got more calls from employers wanting to help, wanting to work with them because they needed good employees. I mean, I'm thinking of Enterprise. Literally, I don't know how they got my name, but they called me and saying, "Man, you know, we heard you do stuff around employment. We need employees." And we talk about it, and we're like, "Well, they're not going to be probably driving. So, some will drive, some won't." And they're like, "We could figure it out." So our larger areas have pretty good relationships. And it is about all the things we know about employer engagement and serving on the business councils and going to the economic development stuff and building those relationships. That was a lot of it. And many of these providers have been doing that for a long time. But I'm not sure they were all knocking on new doors. And that was something else. But then again, I could tell you now, I mean, Toyota's dying for employees right now in Indiana, and we can't get them to them. I mean, transportation's another big barrier. So we are now talking about what are some creative ways. And that was a barrier for a lot of our students, the transportation to some of these other sites. So they started working on that early on. So some implications here for practice that we've been thinking about, and it's not exhaustive, but one of the things that I think was really powerful was that we really had authentic engagement by the individuals who were going to be implementing this. Of course, I did some tweaking along the way with it, but it was those local collaboratives, those local VR counselors, those local providers who were really helping to design this to say, this is how it's going to work. This makes sense. That really was helpful. They also were able to give us feedback. We met in the beginning, the first probably year to 2 years, we were meeting minimally quarterly. We brought everybody together, and the VR director or VR bureau director was there. The staff were all there, and they're saying, give us the feedback. What's working, what's not, what do we have to change? And it was a really good give and take, providers saying when we looked at sustainability, what was it going to take to be able to do that? And when we start thinking down the road with the pre-ets, how that was going to work, we kept coming back to some of that feedback here. We didn't plan for turnover and had no idea it was going to be anything like it was. And it really caused because we knew that we had to always be doing the training and professional development activities. And that we thought that, okay, we did it once with a new job coach. We realized every year we were doing a lot of different trainings. We also did a lot of training with the career coaches. And a couple things would pop up, but when new staff came, there were like little things we had to make sure they knew, such as think about working with high school youth. What do you know about high school youth? About how do you work with them? They're on their phones all the time. So one of the things we really learned was the best way you're going to communicate with them is to text them, right? But we tell kids all the time, don't go with strangers, but yet a job coach pulls up and says, hey, let's go out and do some job development, and the family doesn't know who the job coach is very well yet. So we had a couple of those issues, and we realized that when we were onboarding new staff, there was protocols that we had to make sure they understood, because you can't go get a kid from the high school, take them out of a credit course, and or go and just start looking for jobs or doing discovery without really building the relationship with the family and doing the communication with the family. We also learned that, when you, from a training standpoint, even though they're 18 or going to be 18 or about to be 18 and they're adults, and we know all that, families are still involved. And we know the research is clear that when families are involved, individuals are going to be more successful. They're the ones supporting them. So the reality of making sure we build those relationships with the families and the individuals is so critical. And involving them in the way that the most appropriate is also. I mean, I say that because one of the things even the VR counselors have done a really great job, many of them that we worked with, is making sure the families were at the table too. And yes, I'm going to talk to you, Ian, as a student, but you know, if you're going to be successful, mom's probably still going to be behind you helping, depending on the level of support you're going to need. So we really learned that. The piece about planning for turnover that the families were really clear about, that now we're having these conversations about, is the documentation. You know, who's keeping the documentation? When I had a new career coach come in and said, well, I haven't seen any of the IEPs. I'm like, what do you mean you haven't seen any of the transition IEPs? We got a big caseload of 15 kids this year, and we know you have them all. And so we had to work with the providers as well to say who's documenting what, so we're not starting all over again. So that was a little bit of that start and stops that the families talked about. I mean, their idea was they need the electronic form. Like, you know, our healthcare now is all on that. You know, you can get your appointments in that. They really said that's what we need in the field, so that when that VR counselor leaves or the provider, job coach leaves, I can still access this information. It's just a thought. Now, how we get that done is a little different story. So that was part of that, empowering the students and families with that information. And so the more we can make sure that they do have the information and they understand it, and the roadmaps of it is really clear. The ongoing professional development, as I mentioned before, but that became almost overwhelming with us. My project coordinator, Faith, she met with career coaches almost monthly, coming up with ideas, brainstorming. But then she would have to onboard the new career coaches. And then we ran, as a state, we ran employment specialist training around 3-4 times a year. So we'd have to make sure folks were involved with that as well. But I think the way we are living now with our turnovers, we have to think about this ongoing professional development all the time. How many times do we have to talk about Transition 101? I mean, the basics, that's the reality of it. Not only we have new students coming in, but we're going to, and new families, that we're going to have new staff all the time, and who's not going to have that background. So although we have like a lot of evidence-based practices out there, how do we continue building upon them from an advanced level to the basic level is going to be really important. And then last was, you know, the new policies and changes. And we talked about that in the conversations earlier of it. It was that it really, if we had to do it over again, although at our new employment model, I was the one person who kept saying, can we do this as a pilot? Can we do this as a pilot first to allow providers time to figure out the finances, and for the VR counselors to figure out how that paperwork's going to work? The good news was we met as a group, a large group, statewide group, very regularly. So VR counselors could say what's working for them, providers could say what's working for them or not working for them. And I keep saying it, but we have the best Bureau Rehab Service Director in the world. I mean, she's just like, we're going to make this work for individuals. So we continue to tweak that. But then when a federal policy comes in that's implementing the state policy, and then we move to the order of selection, it is hard. It's really hard. So that lesson learned, and at least when we talk at the state level, is that I think we have to change and be more thoughtful about how we implement even if it's a new procedure, of how we do it very systematically and slowly, because I think personally, all the changes, that's what caused a lot of the turnover in some of the VR system. I think it was like way too much. People were saying, I didn't come into this field to do all of this at once. We had other issues happening within our VR. system as far as staffing in that, and it was a management plan that we first thought about the order of selection, but we changed our education requirements, we changed some things, but certain areas of the state had the highest turnover, so we had to do a lot of analysis. Well, like, what's happening there that we can't get people? So that was really that big lesson that we learned, that we said too much too fast and we lose people. And we also lost people to the Veterans Administration a lot, because I could be a VR counselor and make a lot more money there. And that was really amazing there. So, questions, comments? I think that's. So many of the model that what's happening now is happening in our pre-employment transition services, the self-determination training, self-advocacy training that schools were starting, the career coaches, they're continuing a lot of that, plus all the other thing of their requirements. Yes. One of our rural areas probably was a star in this data. They actually were doing the self-determination training in a gen ed class together, took out the disability stuff, and they co-taught it in an English class, and then the disability specific information was done in a resource room or a study skill time. They probably, not a lot, but they actually got a couple kids jobs that I think probably the career coach quit because he was making more than she was. No, she didn't. She stayed, but they had some really good jobs. But they were also in a special education cooperative that the director knew that it was going to be really flexible and was going to make this thing work. Our urban settings, we had two. I think the challenge there was, for some of the kids, not all, for some of the kids, I wish we could have intervened a little earlier. The self-determination curriculum, I don't have that data, but actually it was those urban settings that said we're pushing this down and starting it at freshman, sophomore year. So we started that, a lot of them started that at the sophomore year, trying to get kids to become more aware about themselves, who they are, their preferences, and starting to learn some of the problem-solving, choice-making kind of skills. Our challenges were different, just because of being in that setting. I mean, I think our first year, not even out of the gate, and we had a kid do an armed robbery and ended up at Department of Corrections. It wasn't the transition I had planned, but we had a lot more of probably, the department chair was really involved in the one district, really involved, and the social worker. So we tended to wrap around our mental health agencies too, who do some employment services, were also at the table with us. So it was sort of like, okay, what's happening here and what do we need? That's the culture piece of a job coach or a career coach going into school. You have to understand the culture of that building, and you have to have an understanding of the culture of that community. So if you're not ready for understanding that and dealing with being culturally responsive in that, there's going to be struggles. And in general, the providers were really good, and because they provided services in that area anyway, they made sure that that match was good for those people. But it was just something we all thought about right away. Any other questions? Thank you all. Appreciate it.